Welcome to Indus Special. I'm Ejaz Haider. COVID-19, the scourge that has spread globally, continues to take its toll. Human lives are being lost, and with Italy hit the hardest in Europe, Iran in the Middle East region. There's a global economic slowdown with several sectors hit by lockdowns across the world. The UN estimates that the pandemic could cost nearly $2 trillion in money lost. Millions of jobs are at stake. And while the disease has not spared developed economies, the developing economies are likely to be the worst affected. The pathogen is the worst global health and security threat since the 1918 Spanish influenza or the 14th century Black Death. States are struggling to cope with the pressure as normal life comes to a standstill. We have a number of issues before us today, and we shall get to them right away. We have with us Professor Steve Keen, who's an economist and joins us from Thailand, and also Mr. Andrew K.P. Leung, who is an analyst and strategist on China at the Andrew Leung International Consultants. Thank you to both of you. Let me begin with Professor Keen here. Professor Keen, in terms of jobs lost and economic slowdown, what exactly are we looking at? $2 trillion is a huge loss.
We really cannot fight this with a market-oriented solution. And that's the problem. Our politicians and the economists who advise them are totally obsessed with market-based solutions. The real way to shut this virus down is to be able to terminate social intercourse for 4 to 6 weeks. That means people have to be able to survive, pay their bills, pay their rent, etc., for 6 weeks. Now, there are most people on the planet could not afford to work for 6 days. So we simply are not prepared for this. And since we're stumbling forward, I think $2 trillion would be an extremely modest level of impact from this virus.
Absolutely, I agree with you. In fact, the assessment says that, these are like ballpark figures at the moment in terms of the curves, but these curves could go anywhere. But tell me, you're absolutely right that most people, and, not just in the developing countries, but also in developed economies, can't afford to not work. And lots of people are working from home. But in countries like, for instance, India, Pakistan, Iran, elsewhere, lots of daily wage labor, and they are going to be the hardest hit. And these are the states that do not have the coffers to actually be able to provide support to them. So this seems to be getting worse.
It is. It's because we have people who cannot afford not to work. And yet the only way the virus can be stopped is by people not working and not coming into contact with anybody outside their immediate personal circle. This is something a market economy cannot address. And it's the lack of imagination of our leaders not to realize that. The virus doesn't care about capitalism. It doesn't care about socialism. It cares about finding a host and moving from one host to another. The only way we can stop it is by thinking in the same way, preventing it moving from one host to another. That means we have to find a way of enabling people to stay at home. That could involve military delivery of food. That could involve military lockdown in terms of capacity to go outside. It must involve people not incurring any debts that they can't repay. Mortgages must not be paid. At the same time, people who are mortgagors must not go bankrupt. So we have to use the state's capacity to create money to avoid this being catastrophically bad rather than just appallingly bad.
Absolutely. I mean, the various dilemmas and ironies. I mean, we were talking in terms of liberal democracies. We're actually talking about, keeping the state away. But that does not really, and I agree with you, does not mean lack of capacity by the state. But before I go to Mr. Leung, just to get a sense of what we're looking at, so 500,000 infected worldwide. US overtakes China with highest cases, over 24,000 deaths globally, over 123,000 have recovered. But these figures, once again, perhaps do not give us the full picture because there are so many states where we don't have testing kits, so we really don't know how many people have been affected by this. But Mr. Leung, this is like, there was a meme, and in these dark times, a bit of humor, of course, dark humor, which said that China created the COVID-19 WhatsApp group And then at the end of it, it says China has left. The rest of the world is part of the group, and China, that created the group, has left. Now, how did that happen? We know there was 13 cities, over 60 million people under lockdown. No other state seems to have that kind of capacity.
Well, first of all, as far as the origin of the virus is concerned, I think Chinese scientists are still divided. And indeed, even scientists in Japan and other countries seem to suggest that there are different strands of the virus, and as many as 5 different strands, and only one strand is present in China, whereas all the other strands seem to have been found in the United States well before the onset of this virus. For example, there was a flu, widespread flu happening in the middle of 2019, and then symptoms are very, very similar to the coronavirus. But regardless of the origin, and China, of course, was accused of suppressing some of the initial findings because at the end of the day, there was a strange kind of disease, never before seen by perhaps any country. It's in the way similar to flu, but it's very, very different in the way it is fastly contagious. And then some people can spread the virus, even they do not show any symptoms. So perhaps it was understandable in the beginning that some of the local authorities in China didn't know what to do. But China very quickly came to grips with it and is now sharing the information a very, very open and transparent manner, as confirmed by Mr. Trump himself in the telephone conversation with President Xi only hours ago. So I think that this is a lot of rhetoric on both sides. I think what the world needs is how to come to grips with it. Now, as far as the Chinese experience is concerned, herein lies the difference between the very different cultures and two different political systems. In the West, it's very difficult to accept that a whole country could be locked down. But of course, if you look at Italy, at the end of the day, people dying by by huge numbers, and that's the only way to slow down and contain the virus is by social distancing.
There's now a consensus that in order to flatten the curve, you have to act early in terms of social distancing. But Professor Keen, another issue, and I'm very happy you said that this is a pathogen that doesn't differentiate between the man-made isms, whether it's capitalism or socialism or any other kind of ideology, economic or otherwise. But this also means that we need to have greater cooperation in terms both of, the research that's going on at breakneck speed, lots of scientists trying to figure out how to come up with a vaccine. In the middle of all this, we still see a bit of old realpolitik or geopolitics. For instance, Iran, which is the hardest hit, has asked for a rapid credit facility from the IMF, but it is still under stringent primary and secondary sanctions by the US. You really think that we need to sort of put a moratorium on old geopolitics in these dark times?
The boycott of Iran should be lifted, so should that of Cuba. All these attempts to one country to punish the residents of another because of their political system should be thrown out the window. This is the sort of thing which a virus likes. And one comment I've seen recently, which is extremely prescient, is that if we don't stamp this out in Africa, we won't stamp it out anywhere. And of course, Africa has extremely poor sanitation systems. It can't do this itself. So we have to provide a massive aid to Africa to enable it to stamp out this disease. So the whole idea of treating ourselves as separate nations and politically at war with each other, whether or not militarily, that has to end. Otherwise, the virus will win.
Absolutely. But it seems to me, Professor Keen, that just when we need more cooperation, that's precisely the time when we begin to fall apart. And I'm talking about, intrastate also and interstate also. Now, how does one basically overcome that?
We have a very difficult time doing it because our political system selects people who are narcissists rather than people who are skillful and understand complex systems. I think we have to really look at our entire political system itself and say, how on earth did we elect leaders like Donald Trump, like Morrison in Australia, who are there for their egos rather than their capacities? We need to have people understand complex systems, making these sorts of decisions, and they would transcend these petty political battles, which are all narcissists can really think about.
Absolutely. But before I let you go, Professor Keane, just give me a sense of, what we have. I mean, of course, there's what ought to be, and then there's what is. So based on the is, what exactly are we looking at, let's say, in the next 6 to 8 to 12 weeks?
Probably a beginning of a social breakdown in America, followed by a mobilization of the National Guard and the Army to keep order. The rate of growth of cases in America is all far faster than China. And now, of course, with a far smaller population, with less than 1/4 of the population now has more cases than China. It's a sign of how badly out of control the disease is there. I think we're going to see, as I said, military mobilizations to be able to bring the level of control that is necessary to stop this disease spreading further. We certainly can't leave it to bickering, Donald Trump bickering against state governors and trying to score political points. But I do see serious social breakdown. I see a strong questioning of all the political norms of the last 40 and 50 years. Neoliberalism and globalization and free trade, I think, are finally out the window.
Well, that's a very dark prognosis, but thank you so much. That was Professor Steve Keane talking to us. Let me go back to Mr. Leung here. Mr. Leung, what do you make of what Professor Keane said in terms of social breakdown, in terms of the fact that much of the values that we lived with or swore by are going to be defenestrated by this pathogen?
Well, first of all, it is a reality, staring us in the face. That what we are seeing now in the United States is a rapid escalation, rapid increase in these numbers. Only about a couple of weeks ago, we were talking about hundreds, and now we're talking about tens of thousands. And then every day is almost an increase of about 20% of cases. So we are only seeing the beginning of a catastrophe happening. And I agree that it's easily translated into social breakdown. But as for a kind of the Trumpism, sort of American first, sanctions and so on and so forth, I mean, that's the reality, really. I mean, that's how a lot of the voters who got Trump into the White House, they still believe that the kind of perceived decline in the United States is caused by other nations. And they're blaming, for example, in this crisis, China, without remembering that, for example, the H1N1 global influenza pandemic spread from the United States to the rest of the world, affecting something like 1.3 billion people worldwide. And no one was holding American to ransom or holding American to be accountable. But then here it comes in the fact that we all live in one world. And the whole world is interconnected, like it or not, even though globalization and international trade have got all his failings, and these failings are being reviewed now as in this virus crisis. But on the other hand, we cannot go back to isolationism. I mean, it's not just a theory; it's a fact that no matter the clothes you wear, the car you drive, that's a very point, Mr. Leung. Let me come back to you on this. But I am also joined by Christian Kaunert, who is Chair of Policing and Security, as well as Director of the International Centre for Policing and Security at the University of South Wales. Professor Kaunert, we were talking about the fact that given what's happening right now, there are a number of scenarios and the prognosis is not really good.
It's not good on the side of the people who are getting infected, the people who are dying. It's not good on the side of economies, jobs, and it's not good on the side of the kind of values that we upheld, neoliberalism and the rest of it. And it seems that there's going to be a social breakdown. What is your reading of this situation if it continues to go on this present trajectory?
Right. Hello. Thank you for having me on. I think you're absolutely right. I think we are entering what is probably one of the most dangerous time in the history of the world at the moment, because we have a double or if possibly triple crisis. We have the medical crisis in terms of getting a lot of people infected, increasing numbers of people dying, national health systems right across the world not being able to cope with the amount of people that they have to deal with, at the same time as now economic activity coming almost to a halt. There are a number of forecasts that seem to be saying that we could be entering the kind of economic crisis that we haven't seen since the Great Depression. And I've even seen some forecasts that are saying that it could be worse than the Great Depression. At the same time as having a very, very significant security crisis. I mean, our police services are stretched to the breaking point. They are now being asked to take on so many new tasks. There's not enough staff available to be doing all these activities. So we're entering very, very dangerous times. And at this point, nobody has a real idea what the world will look like once we get past this crisis. And I think this is a very dangerous path that the world is moving on at the moment.
Absolutely. Before you does, Professor Keane was talking about precisely this in terms of the breakdown. I mean, he was talking about the U.S., if it goes on this trajectory with the military being brought in, and of course, just like the police is stretched, at some point the military forces across the world will also be stretched. And we then looking at life in a completely different way in terms of who's going to provide services, who's going to, there's going to be food shortages and a lot of other things, imponderables that perhaps we cannot really figure out at this point in time.
Indeed, at the moment, what we're looking at, that people are increasingly looking towards the state. The state is there to provide for people. The state needs to guarantee people's safety, security, but it also needs to guarantee their livelihood. Otherwise, as you rightly say, we're going to have a total breakdown of society. And I think this is something that no state can allow to happen. And as a result of that, we're seeing economic plans that we would have never believed in our lifetime to be seeing in the United Kingdom and in the United States and in a lot of Western countries. We wouldn't have thought how important this collective effort has become and how important this total reorganization of economic activity will become, because once we're past this crisis, it is unlikely that we're going to be seeing a return to normal as it was before, because
it seems like we all agree, because these were precisely the words of Professor Keane before I thanked him for insights. But thank you so much. That was Christian Kaunert speaking with us. Let me get back to Mr. Leung here. Mr. Leung, so there are lessons in how China dealt with this. So give us a sense of how you would sort of break down the Chinese response, the salient features of it.
Well, I think that China found at first on the back foot, because there was an accusation that certain findings were being suppressed. But as I said earlier, that was in the early times of this virus, when the whole world didn't know what it was all about. But I think that China's rhetoric is now gaining traction, because even though its state model is not to be emulated by everyone, but the power and the capacity of the state to stare down this crisis has been most impressive. I mean, China started off with almost a nearly falling over the cliff. But very soon the numbers are drastically reduced, and now is being overtaken by the United States and soon by Italy, as far as the confirmed cases are concerned. And also certain cities, even Wuhan, is gradually going back to normal. So I think that China is trying to trump this rhetoric. But on the other hand, and as highlighted by Xi Jinping's telephone call with Donald Trump just now, the whole world needs to work together. And of course, that as you pointed out earlier, there are still sanctions on countries hard hit by this crisis, including Iran and some other countries. But on the other hand, the reality also stares the United States in the face in the sense that they lack, for example, surgical masks. They lack life-saving ventilators, and the reality is that all these are largely almost 80% produced in China. And then with the sanctions, trade sanctions still in place, America has got no choice but to relax some of the sanctions. But at the end of the day, this crisis is a wake-up call for the whole world. You know, how the state should play its role to safeguard the life and security of its citizens, how countries should, on the one hand, being interconnected, but on the other hand, make sure that its own health and other securities are being looked after, and not to outsource everything to other countries. But on the other hand, I don't think that we're going to see a complete reversal of globalization. As I pointed out earlier, the fact remains that...
But there's definitely going to be a slowdown of global trade and economy. I mean, that's what we're witnessing right now.
Oh, naturally, the world is going to be extremely hard hit, and the early estimates of a few $1 trillion is only the beginning of an estimate, because the story is by no means playing out. We're only seeing episode 1 of this an alarming saga, frightening kind of catastrophe. Don't forget that a lot of the developing countries in Africa and in Asia, have not been included. I mean, because there are a lot of cases which have remained undetected simply because of the lack of testing. The low numbers in those countries is the tip of an iceberg. So I think that we're going to see things are going to get much, much worse before it gets any better. And it's going to last a long time. I won't be surprised that the whole thing would last for as long as a year or even longer.
Well, what you've said reminds me of that great line by T.S. Eliot in the Four Quartets, and that to be restored, our sickness must grow worse. Well, that's what we are looking at, and let's hope that it's not as bad as we think at the moment that it could be. But thank you so much. That was Andrew K.P. Leung speaking with us. We shall take a short break and return to continue our discussion of COVID-19 and its impact. Stay with us. Welcome back to Indus Special. We return to our discussion of COVID-19's impact. While some doctors are experimenting with hydroxychloroquine, the med is not FDA approved for COVID-19 treatment. There's no certified vaccine for it yet. Research is happening at breakneck speed. There are more than 20 vaccines in development. One has begun human trials after unusually skipping any animal research to test either the safety or the effectiveness of the vaccine. Other scientists are at the animal research stage and hope to get the results of human trials later in the year. There's also the issue of testing. South Korea's aggressive testing regime seems to have flattened the curve, but testing kits are scarce in most countries. To discuss this further, we are joined by Dr. Carole Lieberman, who's an analyst, psychiatrist, and a specialist in public health. We're also joined by Dr. Ayesha Isani Majeed, who's a radiologist and leads the Breast Cancer Screening Center at Pakistan Institute of Medical Sciences. Thank you so much for being with me. Let me begin with Dr. Lieberman. Dr. Lieberman, of course, this is a black swan event. No one was prepared for this. But give us a sense of where things are in terms of finding a cure, if at all.
Well, the problem is that all over the world, different authorities are recommending different things. For example, the question of whether we should quarantine or lock down or not. And if not, we would be trying for what's called herd immunity. But there are people all over trying to work with these. There are medications that are being that are going to be tested. As you said, yes, typically there are more tests done before a medication is approved, but we don't have time with coronavirus. So
this is an extraordinary situation. So sometimes we'll have to skip animal trials, but then the issue is in terms of the safety and efficacy of the vaccine. I mean, what we are saying essentially is that we now have people as guinea pigs.
Yes, that's true. And there will be some people who have side effects and may even die because of some of these things. But the number of people who could be saved, I think, it makes it worth it to at least try these things, especially with some of the medications like the anti-malaria medications. They've been around for a very long time. Now, so we know that they're relatively safe. They haven't been tried before with coronavirus because coronavirus wasn't here before. But, we know at least that something about the medication. So I think it's worth it to be trying these things. The World Health Organization is going to be doing an experiment, essentially, yes, with all these different medications. And then eventually we'll be able to see which ones work best.
Okay, Dr. Majeed, let's come to you and talk about the situation in Pakistan. Now, of course, we have resource constraints, we have various other issues in terms of what we can do to sort of, mitigate the economic impact of this on jobs and the rest of it. But ironically, right now, it seems, I'll repeat that, it may not be what it actually is on the ground, but it seems that the developed countries are not faring too well either. I mean, look at Italy, look at the United States. I mean, the US has now crossed, in terms of number of cases, crossed even China. So give me a sense of, given our resource constraints, what exactly are we doing here and what are we looking at?
Thank you very much, first of all, for calling me. As I'm working on ground, the main isolation in Islamabad is at the hospital I work in, PIMS, Pakistan Institute of Medical Sciences, and I'm the radiology in charge, part of the core committee of these patients, and we are following their x-rays and we plan on the CT scans soon. So it's very simple. You see that only two successful models in the world at the moment which have fought off this disease, and that's the Chinese model and the South Korean model. So it's very simple. We just need to follow one of these. The Chinese model is the draconian type, but maybe more suited to us, which is a complete lockdown. And the South Korean is a more humane model with the testing kits, which were made available initially. Even now they're producing 1 lakh testing kits a day, and there's 17 other governments who are in touch with them and buying the product. I mean, why can't we do that? That was like testing of the population and then surgical segregation of all who are in touch with the positive. We may not be at that point in our health system to do that South Korean model, though our numbers now aren't that much. We can still follow them. The US can't follow them. They're way beyond that. Italy can't follow them. That is done when there's initially cases detected. So I think that maybe the Chinese model for us with the large population and all that. But there is, at the moment...
Dr. Majeed, let me interject. One, I think you've put it beautifully in terms of the two models that can be followed. The Chinese model, which you rightly said is a draconian model, 13 cities, 60 million people under lockdown. But that model can also be implemented if you have the kind of efficiency and resources that China has. Now, the other one, the South Korean model that you talked about, which seems to me that we could perhaps emulate, but then there is the issue of how many trained people we have that we can send out in the field, whether we have the number of testing kits that would be required for aggressive testing, and so on. So give me a sense of where we are right now in terms of our testing capacity.
People coming for testing, just because of the paucity of kits, it's just certain number who already gotten infected. We know that they're positive. They're getting tested. If the 17 other countries in the world are buying those kits from South Korea, who are producing it commercially now, I mean, why can't we do simple things first?
So you're basically saying that in terms of making a choice between ventilators and testing kits, we should first be going for testing kits rather than for ventilators.
Why not start, treating and addressing the thing at ground level and then build up from there? And they can do both very easily, instead of just procuring equipment by equipment without any end user in the thing and just assuming you need thousands of so much and this, and it's a waste of money.
Dr. Majeed, stay with me. That's a very important point. Let me go back to Dr. Lieberman here. Dr. Lieberman, two models, the Chinese model, the South Korean model. And we just talked about Pakistan, our own resource constraints, our own perhaps policy failures. But it seems that the United States, which has probably the most capacity, the state's capacity in terms of coffers, but being what it is in terms of individual liberties and the rest of it, not being able to flatten the curve in the way that Chinese did. Give me your reading of the situation.
Well, in the United States, for all countries, the problem is that we don't really know. We don't really know the coronavirus. We don't really know how it works. And so in the United States, there are, according to where you live, different states, the governors have made different rules. Some of them have been more draconian than others. Like, for example, where I am in California, the governor of California and the mayor of Los Angeles have put into place stay-at-home orders. Rather draconian. Not that everybody is listening to that, I will have to admit. But then it's because there's another way of looking at it, this herd immunity, as I mentioned, which is when you have enough of the population that has either been vaccinated or that has gotten the disease and has developed antibodies to it. And both of those things can make it harder for new people to get infected. So there's that, some places are doing that.
Dr. Lieberman, let me interject here. You're absolutely right. I mean, look at the 1918 Spanish influenza. Now, today, we get it all the time. And we okay for the most part. But to get to herd immunity, there's a certain cost in human lives that one has to pay. So the issue really is whether we are prepared to make that sacrifice, to actually pick up that cost.
Yes, and the problem is that we don't really know the numbers of people who would be lost one way or the other, and so we're having this sort of mix and match kind of way of going at it. When this pandemic is over, we will have some of the answers to this, but it's hard because there is the issue that you alluded to about liberty and taking away rights and so on, but then we don't want people to get sick. So it's a very hard choice, and really we don't have enough information to make the choice in a very wise kind of way.
Well, before you joined me, I had Professor Keane on the program as an economist, and we were talking about precisely this issue in terms of the state capacity and the fact that, for so many decades, one of the things that we were trying to do was to keep the state away, not in terms of its capacity, but in terms of its ability to impose certain things on society. But it seems now in these extraordinary times of this pathogen that we actually hoping that the state has the capacity to effectively implement lockdowns and the rest of it. But thank you so much. That was Dr. Carole Lieberman speaking with us. Let me go back to Dr. Majeed before I wrap up this segment. Dr. Majeed, it seems that we are at this point groping in the dark. Now, that is something which is scarier than the pathogen itself.
Yes, very true. I totally agree with you. It's like too many cooks spoiling the broth. Everybody's coming up with their own innovative idea. It should be, as I said, I think maybe the Chinese model would suit us because we don't have the capacity or the acumen or the thing for the mass testing and then surgical segregation. So let's have a national policy.
One more point, since I have to wrap up, for my viewers. There's a lot of, how WhatsApp works and WhatsApp groups work. There's so much, and it seems that everyone has some kind of solution for this. I mean, suddenly we all are doctors and, biologists and biotechnicians and the rest of it. Please tell the viewers if it is okay to look at WhatsApp and pick up recipes and remedies from WhatsApp groups.
I think all this social distancing has made people bored at home, and there's too much of this WhatsApp, and there's too much conversation and noise in the society. And I think just a national policy, which is implemented throughout, it maybe most probably it'll need we need the state machinery, which means all machinery, and let's just do that, and then stop discussing and on WhatsApp and trying various medications and all these rumor mongering. This has created panic in the society.
It's creating panic. Thank you so much. That was Dr. Majeed, Ayesha, Isani Majeed speaking with us. This is all for tonight, and this week we shall see you next Thursday at the same time. Meanwhile, for latest updates, you can follow us on social media at indus.news. Good night and goodbye.